Morning from Paris at EuroPCR 2014. I'm Simon Kennon, Editor-in-Chief for Interventional Cardiology Review. I'm delighted to be here with Keith Oldroyd from Glasgow, who was an investigator in the EVOLVE trial. Keith, the EVOLVE trial involved 3 different Boston stents, a randomized trial. Do you want to tell us about the 3 different stents?
Sure. So the control stent was the Promus Element stent, which was the drug-eluting stent at the time from Boston, which had the durable polymer on it and eluted everolimus. And then the two experimental arms were the same stent platform but with a biodegradable polymer. One arm had a full dose of everolimus, the second arm had a half dose of everolimus. So it was a 3-way randomization between those 3 stents with an angiographic endpoint.
Okay, and the underlying hypothesis was?
So I think there is some concern about late catch-up with drug-eluting stents. There is evidence of late stent thrombosis still, and particularly neoatherosclerosis developing in drug-eluting stents. So the concept here is that by getting rid of the durable polymer and replacing it with a biodegradable polymer, these late events will be minimized. And the novel design of the Synergy stent is that the biodegradable polymer elutes within 3 to 4 months, which is faster than any of the other biodegradable polymer drug-eluting stents that are on the market.
Okay, and you're presenting, or have presented, 3-year data?
So the 3-year follow-up data were presented yesterday at EuroPCR, and essentially showed that the efficacy of the biodegradable polymer version of the stent at full dose is equivalent to the durable polymer. Mm-hmm. Now, of course, the trial was too small to show any difference in clinical events. The clinical event outcome trial is EVOLVE 2, mm-hmm. The results of which should be presented at the AHA this year.
The 1-year data?
Yes, that will be 1-year data. So it'll be interesting to see whether the biodegradable polymer on its own is enough to discriminate the 2 products at one year. My hunch is that it will need longer follow-up to show a difference.
Which is being done?
Yes, there will be longer follow-up, but the data that will be presented later this year will only be the 12 months. So
we need to be looking forward to 2016 for the 3-year data, where we would expect to see some good results.
Yeah, and I think that's on the basis of the previous trials with biodegradable polymer mm-hmm. drug-eluting stents, particularly the Leaders trial with the biomatrix device, where the event rates didn't start to separate until 3 years and then onwards.
So you're convinced by the hypothesis?
I am convinced that biodegradable polymers will be better than durable polymers. There is some very compelling animal data to mm-hmm. support that, showing less inflammation, for instance, with biodegradable polymers than durable polymers, and I would hope that would translate into better outcomes for our patients.
Excellent. So we'll look forward to the AHA, and we'll look forward to further results in 2016.
Yeah.
Great. Thank you.